Assalamu alaikum wa rahmatullahi ta'ala wa barakatuh. My name is Hassan Abubakar, a clinical instructor from College of Nursing Science, Istanbul. I'm a registered nurse, a biochemist, and also a laboratory science technologist. In this short video, I would like to explain vividly on what gestational diabetes is all about. Gestational diabetes is the most common medical complication and metabolic disorder of pregnancy. In this video, I provide an overview into the morbidity associated with gestational diabetes, as well as the current method of screening, diagnosis, and management with the aim of early recognition and prevention of complication of both the mother and the fetus. Gestational diabetes mellitus is defined as any degree of glucose intolerance with onset or first recognition during pregnancy. So this definition applies irrespective of the form of treatment or whether the diabetic persists after pregnancy. So it is the most common medical complication and metabolic disorder of pregnancy. The main purpose of identifying gestational diabetes mellitus is to detect women at risk of adverse perinatal outcomes during pregnancy. So there is evidence to show that women who are intensively treated during pregnancy can achieve a near normal rate of macrosomia. Correct diagnosis of this condition is important because it requires dietary control and pharmacological intervention, as well as close monitoring of the pregnancy and the fetus. So approximately almost 4% of all pregnancies are complicated by gestational diabetes mellitus, while the prevalence may range from 1 to 4% of all pregnancy depending on the population and the method of screening. So the pathophysiology of gestational diabetes mellitus, if you can recall, pregnancy is a diabetogenic stage characterized by hyperinsulinemia and insulin resistance. This progressive changes in the maternal metabolism is due to the body's effort to provide adequate nutrition for the growing fetus in the uterus. So what's actually really happened in the early stage of pregnancy? The maternal hormones promote the release of insulin coupled with the peripheral utilization with the end of a lower maternal blood sugar. So as pregnancy progresses, the level of host hormones such as cortisol and estrogen increase, and this leads to insulin resistance. So the peak effect of hormones is seen in the 26th to 33rd week of gestation. So the cortisol, for example, has a very strong diabetogenic effect. So, for example, this effect of hormonal effect from the basic screening in the 24th to 38 weeks of gestation. So, management of patient with gestational diabetes mellitus. The management strategies in patients with gestational diabetes mellitus can be divided into 4 main aspects, which include number 1, monitoring, number 2, non-pharmacological intervention, number 3, pharmacological intervention, number 4 is obstetric management. So in monitoring, where we have maternal, so in non-pharmacological therapy or non-pharmacological intervention, patient education is an important part of the management of diabetes. Women should be counseled regularly to impose the importance of compliance to the dietary and exercise regime. They should also be aware of the implication of poor glycemic control to the fetus. Then in pharmacological therapy or pharmacological intervention, you can give insulin if diet and exercise are inadequate to maintain glycemia. So then the therapeutic intervention with insulin should be considered to identify those women who will require insulin therapy. So frequent monitoring of blood sugar is important. Current recommendation by the ADA includes frequent monitoring of both the fasting and postprandial sugar level at 1 to 2 weeks interval. So number 4 is obstetric management. The goal of obstetric management is to detect fetal compromise and at the same time deciding on the optimal time and route for delivery. Factors such as the size of the baby should be taken into consideration, as the risks of birth trauma and shoulder dystocia increase when the birth weight of the infant exceeds about 4,000 grams. So this will help the clinician to decide on whether to proceed with the vaginal delivery or cesarean section. So the mother should have her blood pressure monitored regularly through the process of labor to ensure that her sugar levels are kept within the normal range to avoid hypoglycemia in the newborn. So a pediatrician should also on the hand at the delivery of seeds. So in conclusion, gestational diabetes mellitus is the most common medical and metabolic complications seen in pregnancy. Women who are at higher risk of developing gestational diabetes mellitus should be appropriately screened to reduce maternal and fetal morbidity. The management of gestational diabetes mellitus should be based on a team approach involving dietologist, obstetrician, dietitian or biochemist, and pediatrician with the valuable support of a diabetes nurse educator.